Assalamu alaikum. I am Reem Fleih Shamri. I will talking about pulmonary hypertension with my friends Dana, Wissam, Rinad, under supervisor Dr. Shaima. Definition: pulmonary hypertension (PH or PHTN) is a condition of increased blood pressure in the arteries of the lungs. تعريف البلمونري hypertension هي حالة ارتفاع ضغط الدم في الارتريز of the lungs. أيضا هي اضطراب يؤثر على البطين الأيمن من القلب ويمكن أن يؤدي إلى قصور القلب. Causes of pulmonary hypertension: high blood pressure in the lungs arteries due to some types of congenital heart disease, connective tissue disease, coronary artery disease, high blood pressure, liver disease, blood clot to the lungs, and chronic lung disease like emphysema. Genetic also play role. من أسباب البلمونري هايبرتنشن اللي تسبب لي ارتفاع ضغط الدم في شرايين الرئتين نتيجة هذه البعض أمراض. طيب مثل وش هذه الأمراض؟ مثل مرض القلب الخلقي، مثل أمراض الشرايين التاجية وأمراض النسيج، ارتفاع ضغط الدم، وأيضا أمراض الكبد والرئة مثل تليف الكبد وانتفاخ الرئة. وبعد الوراثة له دور في أن تسبب لي البلمونري هايبرتنشن. إذن هذه من أسباب البلمونري هايبرتنشن. Risk factor: pulmonary hypertension happens at all age including children and its incidence increase with age. Pulmonary hypertension is more common among women, non-Hispanic, black people and people age 75 or older. Pulmonary hypertension هو أنه يحدث في جميع الأعمار بما في ذلك الأطفال، وتزداد نسبة حدوثه مع زيادة العمر. هو أكثر شيوعا بين النساء والأشخاص السود وأشخاص الذين أعمارهم من 75 أو أكثر. هذولي من عوامل خطر للبلمونري hypertension. Sign and symptoms: shortness of breath, fatigue, chest pain, heart rate increase, right sides abdominal pain, poor appetite, lightheadedness, fainting, swallowing, cyanosis. من علامات وأعراض البلمونري هايبرتنشن هو أنه يصير عنده ضيق في التنفس، تزداد عنده ضربات القلب، يصير عنده إغماء، ألم في الصدر وألم في الجانب الأيمن من البطن، تضعف عنده الشهية، الساقين والكاحلين يتورمون، وتصير عنده إزرقاقة. إذن هذه علامات وأعراض البلمونري hypertension. This is my part. Thank you for listening. Sister Rinad, she will complete another slide.
Assalamu alaikum. My name is Rinad Murdarweli. I will continue to talking about clinical classification. We have 5 groups. The first group, pulmonary arterial hypertension, including idiopathic, heritable, and HIV associated, systemic sclerosis and other connective tissue disease, congenital heart disease, and schistosomiasis and drug and toxin induced. The second group, pulmonary hypertension due to left heart disease, including systolic and diastolic dysfunction and valvular heart disease. Group 3, pulmonary hypertension due to lung disease and or hypoxia, including chronic obstructive pulmonary disease, sleep disorder breathing, and interstitial lung disease. Group 4, chronic thromboembolic pulmonary hypertension, and the last group, multifactorial pulmonary hypertension, including metabolic, systemic, and hematologic disorder and others. Diagnosis of pulmonary hypertension: physical examination or office-based diagnostic test. Physical examination: abnormal pulse oximetry, elevated jugular venous pressure, lower oximetry edema, right ventricle heave, tricuspid regurgitation, murmur. It is an increase in pulmonary component of S2 in addition to sign of right heart failure. الoffice-based diagnostic test, chest radiograph, right ventricle enlargement, engorged pulmonary arteries. Electrocardiograph, right ventricle enlargement, right bundle branch block, right ventricle strain pattern. The last thing, laboratory studies, elevated brain neotritic peptide level. Thank you for listening, and we will continue with Wissam Mdair.
Hello, my name is Wissam. I will continue with treatment and nursing management intervention. There is no care for pulmonary hypertension. There are many different types of treatments, including suprasupine control, inhaled medicine, medicine given through the veins under the skin, medicine to reduce swelling in the feet, oxygen therapy. Nursing management and intervention provide anticipatory care to prevent the development of pulmonary hypertensive event, give immediately care upon the development of pulmonary hypertension event, monitoring ongoing response to adjustment in therapeutic intervention. Thank you for listening. We will continue with Dana.
In the name of Allah, I will start. I'm Dana Saud, and I will complete what my colleague said about the pulmonary hypertension, and I will talk about the nursing care plan. In the first, we have intervention, assist the patient via vital sign and characteristic of the heartbeat at least every 4 hours. Assist the heart sound via auscultation, observation for signs of decreasing peripheral tissue perforation, such as a slow capillary refill, which is normally less than 3 seconds, facial pallor, cyanosis, and cold calm skin. Rationale also to assist and creating an accurate diagnosis and monitoring of effectiveness of the medical treatment. Heart murmur or gallops upon auscultation could indicate pulmonary hypertension. The presence of the sign of decreasing peripheral tissue perfusion indicates deterioration of the patient's status, which is required immediately referral to the physician. Administration supplement oxygen, such as prescribed. Discontinue until oxygen saturation if the oxygen saturated level within target range or as ordered by the physician. Rationale to increase the oxygen level and achieve full oxygen saturation value within target range. Administration prescribed medication for pulmonary hypertension. We have a vasodilator to relax the blood pressure, improve the flow. Also, we have the granulate cyclase stimulators to increase the level of the nitric oxide therapy, decreasing the pressure in them. Also, we have endothelin receptor antagonist to stop the endothelin from the narrowing the arterial wall. Also, we have the calcium channel blockers to relax the muscles in the arterial wall. A digoxin to help the heart pump more than blood. Anticoagulants usually use the warfarin to reduce the formation of the blood clot in the pulmonary artery. Also, we have a diuretic to reduce excessive fluid in the lung. Intervention, educate the patient on stress management, deep breathing, exercise, and relaxation technique. Stress, which causes persistent increase in cholesterol level, which has been linked to people with cardiac tissue. Chronic stress may also causes an increase in adrenaline levels, which tend to increase the heart rate, respiratory rate, and blood sugar level. Reducing stress is also an important aspect of dealing with fatigue. In prevention, we making healthy lifestyle changes, managing high blood pressures, coronary heart disease, chronic liver diseases, and chronic lung disease from the tobacco use. This is our reference. Thank you, and I hope you are interested in our presentation. Thank you.